Um, Most health insurance plans are private. We rely on health insurance from, Blue Cross and Blue Shield or Aetna or, United Healthcare. I mean, there's all types. That's all private health insurance. The only government health insurance programs there are Medicare and Medicaid. But overwhelmingly, most Americans are dealing with private health insurance plans, mostly through their employer. You can't, it's hard to purchase these things as individuals, which is why even if you're a sole proprietor, you have a small business, you'll likely join the local Chamber of Commerce because the Chamber of Commerce is a group of businesses and they can negotiate with healthcare companies to provide health insurance for all their members. So, even the sole proprietors are trying to figure out ways to get health insurance for themselves and their families. Traditional health insurance plans were basically, and they still are, indemnity plans. The only way insurance works is the hospitals or doctors or labs are performing a service and they get paid for every service. If they don't perform a service, they don't get paid. And that's an odd thing because it can provide perverse incentives. Because in order for them to get paid, even if you are generally well, they're going to do a whole bunch of tests on you and just to prove that they've worked on you, they've provided services, and to get paid. Otherwise, if you walk in and you're well and they send you home, what are they going to bill? We saw a person who was healthy. They don't get paid for that. That's not how insurance works. And so there's a perverse incentive to take care of the sick and not see people till they're very sick, because that's how the whole system gets paid. That's how hospitals get paid. That's how doctors get paid. That's how everyone gets paid in the healthcare industry. So that is a perverse incentive. Okay. What we really need to have is a healthcare system and health insurance that actually rewards health. But we don't have that. We actually have a healthcare system and insurance program that reward sickness. So that's a big problem. And then, of course, we have what we call managed care plans as well. So, the fee for service, again, you have an unlimited choice of whatever doctor or hospitals you want to go to. But typically, there's a pretty high deductible. It's a pretty high deductible. And usually the insurance covers 80% of the bill and you cover the other 20%. And that can add up. And so basically speaking, this has been the traditional Blue Cross Blue Shield. This is traditional Medicare. If you are elderly and your parents or grandparents might be on Medicare, this is traditionally how that Medicare plan works. 80% is the payment and they can take care of the other 20%. There's been a lot of innovations and a lot of ways in which they want to save money. And so these managed care plans have become extremely popular. It started in the 80s with the explosion of HMOs. And what you see right now, and there's a lot of these PPOs around, preferred provider organizations. So basically these are deals that have been cut with insurance companies with certain hospitals in certain areas to say, look, if you choose the hospital in our network, if you choose the doctor in our network, we will pay more and you will pay less. You can choose a doctor outside of the network, but we don't have a deal with them, and so because we don't have this contract or this deal with them, you're going to pay more because it's going to cost us more. So you're going to pay more. And so this has really kind of become the way in which they try to, when they say managed care, it's really kind of manage the costs of care, because this overwhelmingly is more efficient and more effective in controlling costs. And if people deal with an HMO or a PPO, they're basically involved in these managed care programs. Again, controlling the costs, very, very important. But in order to control your costs, you have to go to designated doctors and hospitals to get the services. Okay. There certainly are co-payments. Healthcare is known for co-payments. Okay. And of course, almost all the medical services that you would probably need can be performed through an HMO or PPO, and thus they're covered. So in essence, they try to say, look, because we're saving money and we're holding down costs, we can actually provide you with more coverage or even a free annual physical or things like that. So this is how they got popular. You so I'm not going to go into much of the details. So I've really already sort of done so. But HMOs are in of themselves their own business, their own organization, and that's how they organize things and save money. Okay, you have to be a member of the HMO to go to their facilities. The most popular ones, the ones that most insurance companies have turned into PPOs, preferred provider. And so they basically have put together a network of hospitals and doctors, and they have negotiated an amount. Look, we promise you all of these customers that are part of our insurance plan, if you promise us lower costs, lower fees, you're not going to charge $80 for a visit, you'll charge 60. Blah, blah, that's our deal. And so they negotiate the amount to try to save money. You can go out of network, like I said, but you're going to be, they don't have a contract. They didn't negotiate a price agreement. And so you're going to pay a higher price. And of course, how would you know what the prices are anyway? I mean, healthcare is it's kind of weird because, if healthcare isn't a socialized system, I don't know, it's not a capitalist system either, because, you don't know what the costs are, right? It's not like you can go to the doctor advertises, we're having a heart attack special. Come on in. We'll fix you up for $300 only this month and only with your coupon. I mean, you don't see those types of ads. We don't know what the prices are. You can have a broken leg and go to one hospital and they charge, $3,000 to fix it. You go to a totally different hospital, they charge $6,000 to fix it. I mean, how do you know? They don't advertise their prices. So we know you're paying a higher price anyway, but how can it even say that they're trying to save you money when we don't even know the prices we pay for a doctor visit? We know what our copayment is, but we don't know what the actual price to visit the doctor is. And it's the only system that we don't know the price. I would like to walk into a store and start buying stuff. I don't even know the prices of anything you started to buy. That's basically what we're doing in healthcare. We have this whole system where we're using the stuff in the system, but we don't have no idea what it's costing us really. And then we get these huge bills at the end, like, what what happened here, right? This is why I don't like to get into too much detail on health insurance programs, because the whole system actually kind of needs to be turned upside down. I think it's a very poorly structured system, and that's why we continue to have problems with it year in and year out. We don't have these types of problems in the auto or other, even disability. We don't have these types of problems because the prices are included and the benefits are stated. Here, we just have these problems. You just don't know, what you're getting or who's charging you what. For whatever it is. And I'm not sure if that wouldn't matter in an emergency. If you're having a stroke or a heart attack, the nearest hospital is the best choice. But if you actually have choices to actually have an elective surgery, you have a hernia, you have other types of things, wisdom teeth to get out, it might be nice to pick a hospital that charges a lower price and has good service. Just like you would pick, any other business to choose from, because those are businesses. They really are businesses. But in this case, these businesses don't tell us the prices of what they're charging us. So I think it's a real problem. It's a real problem. All right, so I'm going to move on. Blue Cross Blue Shield. Again, a lot of these started as nonprofit. Again, this is a for-profit. Many insurance companies, healthcare, are for-profit organizations. Okay, they want to make a profit, so they want to make sure that they're collecting as much as they can in premiums, and they're paying the least amount from the claims that they get. So it's not uncommon to, your doctor says you need surgery for X, and the insurance company says, well, we don't cover that. Well, then why did your doctor say you needed it? And what's the insurance for? So this is the back and forth, because these are for profits. These are for profit institutions, the hospitals, the doctors, the insurance companies. We do not have anything close to socialized medicine, regardless, even if Bernie had his way, and we just don't have it. We don't have anything close to it. So it's kind of crazy to hear that on political ads, but it is, because if you know the business, you'll know it's just like crazy talk, totally crazy talk. Health insurance, but the government has two health insurance plans. The biggest one is Medicare. Medicare is for everybody if you're over 65. The only thing you have to, or if you're disabled, younger than that, but if you're over 65, it's automatic. We have universal government provided health insurance to seniors called Medicare. And they are thrilled with Medicare. You will never ever hear a senior citizen, I would doubt it. You know, I haven't in all the senior citizens I know, they love Medicare. They love Medicare. And this is exactly what they've been talking about. It's a government provided health insurance. It's not health care, it's insurance. You get health care by going to a hospital or a doctor. That's health care. This is health insurance. How do you pay for that? And so this is the biggest one, and it is universal health coverage, socialized insurance, in other words, not medicine, insurance. But all you have to be is 65, and every person, as long as you're 65 and older, you're getting Medicare. You're getting Medicare. So this is wonderful. It has several parts. The basic hospital coverage is Part A, and it covers all your hospital stays. And then there's other types of things that are covered, visits and other things that are Part B. And this is the one that often requires seniors to contribute a portion of their Social Security or other check to get better coverage for Part B. It looks like I have a question here. Aren't there people unhappy with the 65 age requirement? Unhappy with, well, the only people that are unhappy with this, they think everybody needs insurance. And so what they're unhappy with is the fact that, you know, people are complaining that they don't want the government to provide health insurance to anybody, but yet that's exactly what they do when you turn 65, you know. And so it's, and the people that are 65 and older they're not complaining. They're not the ones who are, you know, well, we don't want any government control of this. They're very happy to have health insurance, you know. People wanted it to, they want it to be for everybody. Okay, one of the biggest things is we are the only country in the world that's developed and has an advanced economy in which we rely overwhelmingly on our employers for this. If you go any other advanced country, up to Canada, across to Europe, over to Japan, it's the government that has their own Medicare-like system for everybody, In most cases, it's not a pure government health insurance plan. It's a basic health insurance plan that the government provides through collecting of taxes. And then you have the option of going to private insurance companies to get what's called gap insurance, which is, you know, all the gaps that are not covered by the health insurance by the government. You can buy insurance programs to cover those gaps. Yeah, I mean, I think that we have a distrust too. Our country was built on distrust of a powerful central government. That was the argument in the revolution against England, is we don't want a king and can tax us without representation. You know, and so even as our federal government gets a little bigger or more powerful, there's a backlash against that, because it's traditionally part of our culture not to have a very powerful central federal government, and rely more on local or states. But unfortunately, it's necessary. It's necessary. We really kind of need to deal with it. It's interesting because this is, again, if you're 65 and older, you get Medicare. And it's funded by the Medicare tax, which is part of your FICA taxes, Social Security and Medicare. Guess who's paying this? Guess who's paying this tax? You are, when you go to work, right? When you go to work, they're taking out of your check the Social Security and Medicare tax. And think about it. There are about 27 million Americans, maybe a little bit more, that do not have any health insurance. Many of those people are working. They're working. So think about how you would feel if you're working And they're taking a tax out of your check that you see coming out of your check every week or every 2 weeks. That's going to provide someone else with health insurance when you need it. I mean, if that isn't a kick in the stomach, I don't know what is. But this is there's a lot of issues regarding fairness and justice around what makes sense. And to a lot of people, it doesn't make sense for people to see that they pay their Medicare tax out of their check when they're working, but yet these folks don't have health insurance. So it's sort of like one of those things. How do you address that? I mean, I don't have an answer for you. I'm just saying that's an issue. How the seniors address that coverage is they can opt for what's called a Medicare Advantage plan, which basically is similar to Medicare, except you have the private sector providing the insurance rather than the government. Okay, and often those plans are quite good, but they're based basically on what Medicare promises the seniors in this case. And what was added back in 2000, early 2000s, was Medicare Part D, which basically means that prescription drug coverages, because again, if you're older, you're more likely to be on medication. Remember, the average American, I think the last statistic I saw, the average American takes about 4 or 5 medicines a day, prescription an average. So we're really kind of drugged up, either way. And so obviously prescription drugs are important. And so this benefit was added in 2001, 2002. It was early in the 2000s, I think. I'm not sure of the exact date, but this basically is helping cover the cost of drugs, which of course a lot of older people are on. There is another healthcare insurance provided. This is health insurance provided by the federal government called Medicaid. It's actually run by the states. So every single state has what's called a Medicaid program. And this is for the state to provide healthcare insurance. Again, we're talking about insurance. Okay, we're not talking about services provided by a hospital, doctor. That's all private. We're just talking about insurance here. And so, this is a state program for the poor. So usually, and again, there's a lot of people that are on, this public assistance program because you have to have, you can even be a little above the poverty level and still qualify. So it's because a lot of those folks are working in part-time jobs or minimum wage jobs for employers that don't give them any healthcare benefits. And so they need that. They need that. If you're over 65 and you're poor, you can be on both. You can have Medicaid and Medicare because Medicaid covers a lot of those basic things that Medicare might not. And again, this is paid by taxes, okay? And this is one of the biggest responsibilities of the state, okay, is taking care of people through this. So that's important. There's another insurance program for if you're injured on the job, if you're injured on the job or the job made you sick, okay, the illness happened because of the job. This is workers' compensation. It's limited to job-related stuff. It's not like this big program, where you can qualify. If you're at lunch and you hurt yourself, too bad, in most cases. I mean, it's horrible in that way. You actually have to be on the job and get hurt. Or so the injury has to occur on the job. That's really the thing. And it basically covers the healthcare costs. And if you need a rehabilitation, this is what this insurance will cover. If it results in a death because of the injury or the illness, usually there is a lump sum death payment. And it's one of those things. If you're self-employed, you're out of luck. It doesn't apply to you. It is basically it's an employer-based tax. It's actually a payroll tax. It's part of a payroll tax because it's based on the number of employees you have in their first, I think it's $6,000 of earnings roughly that the employer is paying in. I think, not 100% sure on the number, but definitely the number of employees matters. Well, there's been a lot of attempts at healthcare reform because clearly, if you don't, I mean, like I told you, just knowing that you can go shopping at a mall and you see the prices on everything, so you know exactly what you're buying at what price. Our healthcare system, you have no idea what the prices are. And for some situations you don't care because an emergency situation, the closest hospital is the key. But if you have an elective surgery, maybe it's good to shop around. Maybe you prefer to drive 20 miles extra to another hospital if you know they're gonna charge you $3,000 for an operation rather than $6,000, knowing that you might get a bill for some or a portion of that. But we have a system that doesn't do any of that stuff. Okay. And it costs a ton of money. Okay. Our US economy, if you look at the broad economy as a whole, we spend more money on healthcare than almost any other area. And so this is a real problematic. It's a problematic area. It's just costing us more than any other country on healthcare. And so some reform is needed. And you know how your healthcare system is doing by looking at the data, looking at what's our infant mortality rate? How many babies make it past, through birth without complication and so forth, or how many babies die at birth. And sadly, our infant mortality rate is not as good as some other countries that are developed. With what we pay for healthcare, it should be number one. We shouldn't be losing hardly any babies. I mean, obviously, nature has things that happen, and sometimes an infant will be lost, sadly. But we should be doing a lot better. We also should be, with all this healthcare, we should be living a long life. Actually, our life expectancy just declined. It's crazy. And we live in a society that we eat so much crap, sorry to say that we have cardiovascular problems, starting at earlier and earlier ages. Okay. And we just have a huge problem in this regard. We have the most expensive healthcare system and we're not healthy. So maybe we should look at that. Okay. And so that's basically part of it. And again, if you're a healthcare provider, you only get paid for providing a service. That's how the system works. So it does, like I said, it's a perverse system because it does encourage unnecessary services in order for the healthcare provider to get paid, the hospital or doctor's office, or they will do extra stuff to get the money because that's how they get paid.
I wanted to mention something.
Yeah, go ahead.
Because I used to work in the service industry on commission, um, companies do not provide insurance. So I've seen the gamut of it. And what they used to do is go approach a company as a group, and they didn't pitch in, but they'd say, okay, we have, 50 employees, give us a discount. And the last I got that, I guess, was 10 years ago, something. And it was 1,200 a month. And it
Wow.
was good insurance. And then it started just getting out of control. And I started working for myself. And I use New York State of Health. Is that considered Obamacare?
It's part of it. I'm going to actually get to Obamacare right now. In fact, it is the Medicaid program for the state, and the expansion that's talked about under the Affordable Care Act, or what was known as Obamacare, is basically, look, we have 27, 28, 29 million people without insurance. Their employers don't provide insurance, like in your example, Clark. Why don't we let them buy into the Medicaid program, and and so forth. Matter of fact, let's get everybody in the Medicaid program who doesn't have insurance, so at least they have some insurance. Even if we have to start charging fees for people, which is how it all started. So yes, it is definitely part of that, and it's part of the problem that we've been looking at. The Affordable Care Act, and let's get to Obamacare, because that's the Affordable Care Act is what we look at. Patient Protection Affordable Care Act is commonly referred to as Obamacare, but it really is this legislation. The goals of this act is to make sure that citizens have health insurance. Okay. And of course, to try to reduce as much as possible healthcare costs. Okay. And in insurance, it's kind of weird how it works. In insurance, it's easier to control costs if everybody is in the program. Because it's so much easier to use statistics and probability when you know everybody is in. And thus you can be more accurate in understanding the needs and the costs and pricing it properly. And so we don't have that. Again, we have about roughly 10%, maybe 8 to 10% of the Americans that don't have insurance. And so, but they still need the hospital. They still get sick, they still need a hospital. So when they go, they can't pay. Who's paying that? All the people that have insurance is paying that. So it's unfair to us that have insurance to pay for that. So, you know, in essence, it's important to know that one of the goals here was to make sure everyone had health insurance. So everyone's part of the insurance system and everyone's paying something toward that. And so in that sense, that was really the best goal for the Patient Protection Affordable Care Act, or Obamacare. It has been subject to a lot of lawsuits, and it might go down under the pursuit of the Trump administration to kill it off. Basically, is still proceeding, and it's going to Supreme Court in 2 weeks. So that might kill it totally. We'll see. We'll see what happens. So what this and this basically, your book kind of goes over what it is, but what it basically did is it said, look, for all your employers that have these health insurance plans, and for all your insurance companies that offer these health insurance plans, there's a few changes. One of the changes is pre-existing conditions have to get covered. Okay. And that means that, because before, if you had a pre-existing condition and you moved from one employer to another, you got a different insurance company from your new employer than your old employer, because they use a different insurance company. Your coverage started there, and it says, oh, well, you already had this. It's a pre-existing condition. And we're not going to, if you get sick from these, we're not going to pay. So they said, look, it doesn't matter. We all sort of have pre-existing conditions because our genes kind of show that all of us are born with some, proclivity toward developing a certain illness. So in essence, we all have a pre-existing condition. So why don't we just wipe this idea out of the law and say it's against the law to do that? And that's basically what this did. Obamacare did. It extended coverage for children until age 26, which is a long time. But oftentimes when kids are young, they are not necessarily working for employers that offer health care. And so this at least covers them until age 26. Hopefully you can be established by then. Insurance policies had dollar limits. So they would not spend more than $1 million on you in your lifetime. And so as soon as you reach that $1 million limit, oh, well, your insurance is no longer good. You have to pay the rest. So they basically said, nah, that's not a good idea. Let's get rid of that as well, because, healthcare costs are going high. So $1 million operation isn't what it used to be, So yeah, basically said that's not a good idea anymore. One thing that it definitely did is said, look, you have to cover certain things you're not covering now, which includes preventive care. Preventive care is overwhelmingly, this idea that if you go to the doctor regularly, get your vaccinations, get this, get that, you're more likely to stay healthy, and thus you'll cost the system less. It'll be if you are healthy, you take care of yourself, and that's your habit in your teens, your 20s, your 30s, your 40s, then you're probably not going to get sick in your 50s, 60s, and 70s. You probably won't get sick until you're very, very old, if you get sick at all. And so let's cover that. Let's actually encourage it. because that's health care, caring for health, right? It also involves all those medical screenings. And so, again, you can know up front if you're susceptible to something and, get tested early so you can nip it in the bud. It's much easier to nip it in the bud. It's very likely that if you know you have cancer and it just started, you have a very good likelihood of surviving that. If you don't know you have cancer until it's stage 4, you're a dead man. Okay. And so the medical screenings is supposed to be, look, it's better to screen early, catch these things early, because one, we can operate, it's less costly to save you. And number two, you live a longer life. And so that's part of the medical screenings. And they actually, insurance companies, this is a for-profit industry. They want to make a profit. So everything they collect, they don't want to really spend. And the law said, look, you have to spend at least 80% of your premiums on the claims that the customer paid for. You can't be pocketing this and, putting it into profit or all this other stuff. You gotta do the right thing because it's healthcare. This is healthcare, so it's different. They did have these insurance exchanges, which basically allowed the states to offer Medicaid-related products that they develop, New York Health, things like this, to everybody who didn't have it. Okay, and it's paid for by a fee based on the level of benefits that the plan offers. More benefits, the higher the fee. Which makes sense. If you have more car insurance, you're going to pay a higher premium. So nothing there. Okay, so again,